So everyone will be able to follow along on page 87 of your manual, session 4, Know Your Medicines. This is an important one today. Well, not like none of them are. This usually gets a lot of good conversation because we're gonna actually dive pretty deep into the medications and how they work, and possible side effects and possible costs. And I'm glad we have Karen here too, just in case anyone has questions about cost. Not like you can answer the questions, but we can at least give them resources. Yes, Frank?
Well, you want to really this is fine. That's why I'm in my bed. Yes, cost.
Yes.
And it's some people's medicine.
How about if you write all your questions down, Frank, and I'll put them in the comment box after class.
This is not big enough.
I know. I know. I
You
know.
can double up.
Yeah. We have another one.
I have one that's a big issue because I take in the morning, I take 14 pills and at night 3. So, whoa. This little thing here.
Yeah, that won't cut it, will it?
Oh,
All right.
but you know what? Keeps me alive.
There you go.
Alive and kicking.
Yes, you're right. You seem to be doing pretty well, so that's a good sign. So we're going to get right into the different types of medicines. Jacob said we need to end at 2 because he has to take this camera. But if anyone has other questions, we can stay a little after 2 if you want to. You would just have to take the camera. So I just have to be done with class itself by 2 o'clock, okay? And I know you have your exercise class. So that's a lot of different types of medicines now that are available for treatment of diabetes. We're gonna kind of go over all of them because, as you know, diabetes is a complex situation, right? There's a lot of different ways to manage it. The most common one is called biguanide, which is another name for, anyone want to guess?
Metformin.
Metformin, that's right, yeah. And I think too, that's also the most commonly prescribed medication. A lot of times, even if somebody has pre-diabetes, sometimes they'll be prescribed metformin just to keep their blood sugars under better control to avoid that diagnosis. That one works by reducing how much glucose is produced by the liver. So metformin works directly with the liver to reduce the amount of glucose that it produces. Some possible side effects that people might experience would be upset stomach, bloating, vomiting, diarrhea, and in very rare cases, sometimes it can cause some acidosis if somebody has a liver or a kidney disease already beforehand. I've also heard another side effect that somebody had, which I think is more rare, but she had some memory issues when it came to like driving directions, which was weird. It like affected her cognitively. I don't know if any of you have heard that with any friends or anything. I hadn't heard that before. But yeah, metformin is probably the most commonly prescribed in the very beginning for diabetes. Then you have the sulfonylurea, which is hard to pronounce, but you hear about this one on TV a lot. Also known as liporide, lipizide, anything that ends in zide would be one of these. And this one helps the pancreas produce more insulin. So rather than reducing blood sugar, it increases insulin that is sent out by the pancreas. So you guys remember in class 1, the insulin comes out from the pancreas and makes it be taken into the cell, right? And that's its job. So by by creating more insulin, it is able to help control the blood sugar in the bloodstream a little better, right? So that actually can have some side effects of low blood glucose, some skin irritations, some irritability, some upset stomach, and weight gain. So these are the more common side effects. Doesn't mean there might be some rare side effects that can happen too. But if you're on any of these medicines and you experience any of these side effects, you're gonna wanna talk to your doctor about it. Some side effects people don't realize they're having. Some they might not relate to their medications. I've heard that many times. Like if you start a new medicine and 2 weeks later you're feeling really irritable, right? That's a good thing to talk to your doctor about, just in case it is a side effect of the medication. Then you have the DPP-4 inhibitor, and that one actually works along with GLP-1. So that one prevents the breakdown of GLP-1, which helps reduce the blood glucose when it's elevated. It does not reduce the blood glucose if it's not elevated. So again, this is why we have our books, because there's no way you're going to remember all this. And this is also a good tool because if you're ever prescribed one of these medicines, you'll be able to look back in this book and say, okay, this is the one they put me on. These are the side effects that I need to watch for, and this is how it works. So at least now you're gonna know what you're taking, why, how it works, and what you might expect with side effects. Very important, right? GLP-1, I think everybody has heard of because it's all over the place now. It's all over TV, it's all over the radio. You can get it from pretty much anybody now. It's extremely popular. That actually works by reducing the GLP-1 hormone, which is the hunger hormone. So people actually start having less of an appetite and eating less, right? So some popular names like Ozempic, Wegovy, those are both GLP-1 medications. Something to keep in mind if you are prescribed a GLP-1 medicine, the risk of side effects is pretty high. Hopefully if you are prescribed this medicine, you don't get good side effects. There are some good outcomes from the medicine. Very important to make proper lifestyle changes while you're on the medicine. So hopefully if you have a doctor that's going to prescribe this same doctor also makes sure that you know what you're doing when you're taking it, right? You should be doing strength training so you don't lose muscle. You got to make sure you're eating the right nutrients because when you're not hungry, you're going to eat less and you don't want to have nutrient deficiencies, right? Most of the time if somebody takes a GLP-1, the weight that they're losing is about 50% of lean mass. So, because you guys have seen, I know everybody in this room probably knows somebody taking it, and when they have that rapid weight loss, that's not just fat. A lot of it is also lean mass, which means the metabolism's slowing down, and you're at risk for a lot of issues. So always make sure you're getting the lifestyle changes in place. Go ahead.
I did try that because my A1C dropped so high. Well, my doctor prescribed. First she did Wegovy and then Ozempic, but I had terrible side effects with, my husband saw it on TV because, go through all the different side effects.
Yeah.
But my whole one side of my body went numb.
Whoa.
It was like I was having a heart attack. I was having nausea.
Whoa.
It was crazy. And I waited until the next day, which everybody yelled at me about it. My husband was like, you need to go right now. But I figured if I could get to him and I fell out, then he could revive me. But my doctor was saying, my doctor was saying,
You must have a good husband.
he's very good. He is beautiful. Takes good care of me.
That's awesome.
So we weren't aware of all the side effects, and my doctor was, but you know, it goes over their head. So she wants me to do a clinical trial, and I was like, I'm not taking that because 10 years ago I took that one that was like the Humana dragon. It was almost the same stuff, but it's really Humana dragon saliva. I can't remember the name of it, and I had a bad reaction on that. My face went numb.
Wow.
But with that Ozempic, it almost killed me.
Wow.
So,
That's powerful.
I recorded it for my doctor on TV just so she would see that they have it and they advertise the side effects, but I guess they don't think it's going to hit. But I guess
Yeah, that's a powerful testimony right there. That's a major reaction.
it was, yeah.
Wow, there's a lot of different side effects coming out. Some extremely severe like that, and then some like a lot of vomiting, a lot of diarrhea, a lot of dehydration. But even as a result of not eating much, you're hearing stories of depression because when somebody's lacking those nutrients, it affects their brain, and you're hearing a lot of emotional issues happening too. So there's just a lot. So that's why I like give a big warning. If it's absolutely necessary to go on the medicine, make sure you're getting the right guidance, that you know they cover all the side effects with you, that you know the lifestyle changes you have to make while you're on it, because it can be a nightmare otherwise. And coming off of it is not easy either, especially if you've been on for a while, because your hunger comes back full throttle. Not with everyone, but it does. And if they've lost a lot of lean mass, they'll gain the weight back pretty quickly. So what you do while on it is vital. Go ahead. And I know you had a question too, John.
My question,
No, go ahead, go ahead.
My question is the same question I have all the time. How are we supposed to get, if we don't have a proactive doctor or provider, the support system or the right guidance that we need when we're going through what we're going through? Because half the time when we're going through, we're semi-conscious of it, or maybe not conscious of it at all.
Yeah.
How are we supposed to get the right support or guidance that we need? I mean, you understand where I'm going with this,
Of
right?
course, I do, yeah. And some doctors are making sure that those things are in place. There's a doctor who works with Conviva, which is the Humana-owned primary care, but it's in Florida. And he sends his patients to health educators with Humana because he knows that they need the lifestyle support while they're on the medications. And he actually makes them lose their first 5 pounds on their own before they even take the medicine, so he can see that they do it, you know, that they can handle it. So really it's a matter of finding the right medical team and a doctor that you trust to ask who is going to support me during this medication, because the last thing you want is just to be written that prescription and sent home without any guidance, right?
So the team should be, besides for your endocrinologist and your PCP, who should be working together.
Yes.
And health educator, a nutritionist, and what else?
That should do it. I mean, yeah.
So if you're not being directed to a team,
Yeah.
then you need to question what your doctor's doing.
Or you just need to ask your doctor who will support me while I'm taking this medicine.
I would ask you.
Where can I go
Yeah.
to make sure that I'm doing the right thing while I'm on this medicine? Who should I call?
And it should be from your PCP or from your endocrinologist.
Whoever prescribes the medicine should be responsible for that, in my opinion.
I don't know if this applies, but I was wondering about medicines today as well, in the other class. And I went to Dr. Casey here, who will check
Oh, yeah.
all the medicines and how they interact. So I've got an appointment with her. And that's a doctor who will look at various medications you're taking and how do they interact. So I don't know if that's part of your question.
Is that the pharmacy person?
Yes, it's here. You have to set up an appointment.
Yes.
It's here.
And she's gonna be here, when was that, Karen?
The 14th?
She'll be here the 14th.
I have an appointment every March.
Oh.
On
So
April
it's different
14th.
dates.
Yes, and you can sign up at the front
At the
desk.
front desk, you can make an appointment.
Okay.
Because she comes twice a month.
Yeah. Yeah, so that's a good one to go over side effects with for sure, a pharmacist. Yeah, and that's at no cost here, so great resource to talk to. John, did you have a question?
Yeah, the LP1,
Yes.
the lady in my class, she helps me teach kettlebell. Her daughter lost her gallbladder. Because she lost a lot of weight,
Yeah,
which is great,
yeah.
but you gotta be very, very careful with these drugs.
That's a very serious one because it's actually shutting off a hormone that is a natural hormone, you know. Yeah, I've seen a lot of really freaky things come out from that medicine. So yeah, you do have to be careful. Christine, did you have a question?
I don't see an endocrinologist, but my doctor, my general practitioner, has me hooked to, because I have a pod, and I went yesterday, and he was very happy because my A1C went down. And he follows me very closely. So, I think you have to trust your doctor and ask more questions sometimes.
Yes.
If there's not. And that's one of the things, because I went yesterday, so I was asking questions because I'll be moving to Vermont. So I was asking questions about the doctors and all that stuff, and I found out by my cardiologist this morning that Epic is there, so
Yeah.
like that, it won't be a problem. They'll transfer all my records up there.
That's great. That's
That's
a load
a
off.
relief.
Yeah, absolutely.
Are you familiar with Arcega and where that would fit on this?
I've heard of it, but I don't know.
Or where that would fit here?
If you have it or you know somebody that takes it, there should be another name on the medication bottle, like a generic name, and it should match one of these.
It's on TV a lot.
So it's in that family?
I'll find one of these.
It should be on the bottle. Yeah. Yeah. So a lot of times, like, this book is not gonna have the name brand, right? But you'll see on the pill bottle, I forget how they word it, like, otherwise known as blah, 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 like whatever the generic name is, you'll usually find that on there too. Like I know semaglutide is Wegovy, I wanna say, so. But yeah, your doctor should also be able to answer which category it's in, or you can actually look that up on Google and trust that information. You can say what type or what class of medication is blah, 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 and it should tell you one of these answers.
Can I just say one thing? You have to really be the biggest advocate for yourself, because there is really, I mean, they care about you, but you care about you. Yeah, you really do. You have to like you have to push for what you want and not be afraid to push.
Yeah.
So how do you know, I mean, I'm relatively new to this, right?
Yeah.
How do you know what you're pushing for? Because if I had not attended this class,
Well, see, you're being an advocate for yourself because you came to this class.
I mean, I let it out, okay?
Yeah.
So, I mean, I'm coming to Lake Forest for a class, but I live in a completely different city. So how do I know? I mean, I just happened, because I was looking for the martial arts class here, to stumble across this class on the calendar. How do you know? I mean, let's be real about it. I mean, knowledge is everywhere true. I'm just one that Googles and searches the website. My mom asks me all the time about how I find out about stuff. But I'm just a very curious person. Most folks aren't like me. I
Yeah.
always have a million and one questions,
Yeah.
sometimes annoying, but my point is I'm always searching for the knowledge.
Yeah.
Most folks aren't that way.
You're right.
How do you find, I mean, how do you learn about How do you know what to push for? How do you know what you're supposed to be? I mean, I can go on the internet and I'm overwhelmed with an abundance of knowledge, but basically starting out, how do I know what I'm pushing for?
That's a good question.
Not like you, so they don't even.
Right,
They're just
that's my
You
point.
don't.
I'm just
You
a
don't know.
inquisitive person, and I
Yeah.
always have a million questions, but how do you know as an ill person who's struggling to try to get up and get one foot in front of the other every day?
Yeah.
How do you know what you're pushing for?
You don't. And that's terrible and
we
sad.
depend on people. We're paying $700 an hour to give us the, well, you know what I'm saying, right?
Yeah.
To give us the information that we need to get
I
the
know.
right resources.
I know. You're 100% correct. Yeah.
Karen says.
And it's awful and it shouldn't be that way, but it is.
I have a, oh, go ahead first.
You know, I have to commend Humana because I do have that insurance. And whenever I call with a question or anything, I always find the correct answer. Or the right answer if I don't know it to help me.
I'm glad that's your experience.
Yes, I also have, I'm a Duke patient. And with Duke My Chart, I just had a training spell a couple of days ago. And I contacted all my doctors through Duke My Chart. And every one of them got back to me. I'm a little late because I went to my medical doctor.
Wow.
For a follow-up from the ER.
Wow.
You know, they're always on top of everything.
Yeah.
And if I have any question about anything, even if it's not about my health, I can call any one of my doctors or, what do you call it, text them
Yeah.
in my chart, and I'll get a response back within a couple of days.
Yeah, sometimes it depends, I'm not
Very
just
good.
pumping Humana, but it depends on your insurance company too.
Yeah.
Sometimes they don't, you're just like, you have XYZ insurance. You call them up, they'll be like, yeah, okay, your bill, whatever, you know. Humana has put all these supports in, like Jill,
Yeah.
for instance. Now, I don't know what other companies do, but we are, like we were talking about in the other class, we want to keep people out of the hospital. It's better for them to keep people out of the hospital than put them in the hospital. Because it costs more money to have people in the hospital.
Yeah. Yeah. Go ahead, John.
Yeah, someone mentioned Farxiga, right?
Yes. Did you look it up?
It's part of the SGLT2 inhibitors.
Okay.
It's, I don't know how to pronounce this stuff. It's DAPAGLI.
Okay.
Flosion.
Ends in Zin.
Zin.
Yeah, so the ones that end in Zin are the SGLT2. So that's the one you were asking. Thank you for looking that up. That's the one that keeps the kidneys from reabsorbing the glucose, and they excrete it into the urine instead.
Right.
Common side effects are urinary tract infections, yeast infections, and increased urination, which makes sense because it excretes the glucose through the urine, right? Also makes sense why there would be more UTIs common with that. Yep. And you can see the costs on the right. That's before insurance, just so you know.
And is that monthly, bi-monthly?
Monthly.
every day?
Those are monthly prices.
Because I checked that with Farxiga, with CVS, it was 800 something for a 90 day, which is like $275 a month.
Yeah. Yeah. So that again is why, you know, you want to have, there's some insurance companies, I know they're putting a big halt on like Ozempic prescriptions. There's a lot of companies that won't cover Ozempic unless somebody has uncontrolled diabetes. Like they will not prescribe it for weight loss only, right? So it really depends on what policies your insurance has on why they would prescribe a medication, but a lot of times they're going to want to see you try first, you know, try the lifestyle change, meet with an RD, do the exercise program, and then maybe if that doesn't work, try the GLP-1, but they're probably going to want to see your lifestyle change first, hopefully.
Okay, my insurance is with my ex-employer. I have Aetna. And since I retired from GlaxoSmithKline, if I would change insurance, then I would lose the privileges forever. So how do I go about trying to get a representative from Humana? And we can compare things so that I don't, because, so I don't get screwed. And, you know, if I change from Glaxo, which is Aetna, to another one, and then I can't go back to Glaxo, you know, once I get out of the system.
Glaxo for your.
GlaxoSmithKline is who she worked with, and
I
she
used
gets
to work for
insurance
them.
through
And I have
that.
Aetna, I have Medicare and Aetna as
Your
second.
secondary.
But, I mean, I'm paying my, you know, I'm paying $222 a month of premium with Aetna. Huh?
You are.
Yeah.
Christine and Karen get together after class.
Okay.
That's what Karen does.
Because that's what I'm afraid of. That
Oh, I can help you.
If I change, then I'll be stuck forever.
Yeah, but it may not be a bad thing if you find a plan that's affordable. and
Yeah,
works.
exactly.
Yeah.
I mean, that's what.
That's your girl.
So your insurance
Okay.
is attached to your pension, and if it was, we can look that up too.
Okay.
If it was attached to your pension, we wouldn't want to touch that. So
Okay.
that's like what I do, I'll go through and I'll.
Okay.
I don't just go.
Awesome.
I'll just tell you, man.
Okay.
I go through and figure out what's the best for you.
You know, when you don't know, I mean,
No,
I need
Yeah.
to talk to somebody.
And to be
that
honest
does-
with you, you asked why I come to these classes and stuff. That is so.
This
I
is
can
exactly
form a
why.
relationship So that you know me as a person and not just as, oh, that's a lady that sells Humana.
Yeah.
Because that way there you feel more comfortable.
And
So that's why.
I can't do what Karen does. I couldn't look up, I have no Medicare knowledge of plans. I couldn't look things up for Christine. Karen is licensed to do that, so that's why I asked her to come, because people always have questions and I can't help them, and she can.
Like,
And I'm not, if
I've
you,
gotten some
like I
phone
said,
call from Medicare.
Humana doesn't benefit you, I just say, you're better off, because I like to sleep at night. It's a big part of it.
But you know, I mean, I don't know that person, you know. so-
I got you. I got you.
It's-
Like, I have to see you again, Christine, if I screw you over. I can never come back here. If you could find me, I live like down the street, so. that's-
Karen has integrity. I wouldn't have her here if she didn't.
It would probably prescribe tequila.
Tequila.
Right. Yes, exactly.
Everything goes out the window, I'll bring my bottle.
That is one thing that I have to say, all of my colleagues that I've worked with at Humana, they all have integrity. They will not talk you into something that will hurt you. It's just not gonna happen. So the medication, next one on the list that ends in ions, I'm not even gonna try that one. But that one makes the muscle and fat more sensitive to insulin, so it can help reduce the glucose production in the liver. So if you're on one of those, you might get some side effects like swelling, fluid retention, increased risk of congestive heart failure. Yay! I would definitely rather try lifestyle change first. Yeah, I'll keep my diabetes thing. And the generic is available with that one. And then everybody knows insulin. There's a lot of different kinds of insulin and they work differently. Some are fast acting, some are long acting. You might be on two different kinds, fast and long acting, and different levels of units. And that's gonna depend on how controlled your blood sugar needs to be. Usually if you have type 2 diabetes and you are prescribed insulin, your pancreas isn't making as much insulin as it used to. Not a horrible thing, but usually that's when your pancreas is starting to kind of get a little worn out, right? With type 2 diabetes. Type 1 never had insulin, so they'll always need insulin. But that doesn't mean you still can't do the lifestyle change to help manage it, right?
Oh, so you can't take insulin?
You can,
No.
type 1 take insulin.
Yeah, type 1 has to take insulin.
Oh.
Yeah, they're pretty much born without making insulin. Yeah. Okay, so talking about medications, a few things that you absolutely want to do when you're being prescribed a new medicine, right? One is you want to ask about the medicine. How does it work? Will I expect side effects? How long might I be taking this medicine? Do I take it with food? When do I take it? All of the questions, right? And you don't have to ask your doctor these questions. You can ask your pharmacist.
Yep.
And if you have Humana, which it sounds like a few of you do, Centerwell Pharmacy, which is owned by Humana, they have amazing pharmacists. And every 6 months, they do an automatic review of your medication to see if there's anything, contraindicating with each other. Say, hey, you're not supposed to take this one with this one. They will kind of document all of that. And you can always call and ask questions to the pharmacist there.
Can you repeat those questions?
Yes. Let me make sure it's not here. Okay, so write this down too. The brown bag review is a review of your medications that all pharmacies should be able to do that you can make an appointment for. And that's just when they go through your list of medications, you can ask them, am I at risk for, dizziness or tiredness? Is there anything that I shouldn't be taking together? I'd like to try to take turmeric. Is there something I should know about a medication interfering with it? Time of day, side effects, how long will I be on this? All the questions answered before you even start taking the medicine, because it's much better to get those answered ahead of time than get one of the side effects and have to deal with it later, right?
He said, should I take it with or without food? Right?
Yeah, that's always a question. What time of day? Do I need to avoid anything else? Can I take my allergy medicine with it? Can I take an Advil? Can I, the slightest little thing can throw it off. So you're right about being your own advocate. It's hard to be your own advocate, but it's also scary sometimes to just trust what you're hearing. I can't tell you how many times, Karen, probably the same, we work with 65 and up population. There's so many people that don't even know what they're taking medications for. They'll bring me their 6 or 7 bags of medicine and be like, what are all these for? They don't even know.
Yeah.
Or
sometimes the doctor just keeps you on it because he had you on it. And it's
yeah.
What? Why are you on this?
Yeah. 4 or 5 different blood pressure medicines.
Yeah.
I've tried and it doesn't make any sense. These things come with 10 pages of small print.
Oh,
yeah.
I tried to read through that. It don't make a whole lot of sense to me.
I know. And it can be scary too. I might die if I take it. Yes.
Well, that's when I saw congestive heart failure. I thought, really?
I know. Yeah. Yeah, they're required to talk about all side effects that are possible, including the rare ones.
Who is?
The pharmaceutical companies on the
Yeah,
labels.
that's why he sent me the labels. And you know what? They're plenty and a lot of information. It's good to read it because then you know exactly what you're taking, why you're taking it, and the side effects of it. It is important to read it.
It is, yeah. Or sit, with your pharmacist and talk about it. Ask
So I
about
just
it.
got an appointment?
Yes, with the pharmacist.
Yeah.
Yep.
Oh.
Oh, yeah.
Yes.
No clue.
Well, I'm glad you're here. You should all be proud of yourselves just for being here.
My pharmacist, Helene, says, oh, Cheryl, what is it? What is it this time?
That's the relationship you want with
She
your
knows
pharmacist.
me, and she knows that I'm gonna question.
Right. That's what you want. Exactly what you want. That personal relationship. That is a good pharmacist. Awesome. Remembering to take your medicines is a whole other ballgame, right? As far as remembering to take medicines, what are some things you guys do to try to remember when to take them and that you have taken them? Yeah. The pill boxes with the days. Yeah.
All the money.
There was somebody in my diabetes series in Greensboro, and he said he never remembers to take his medicine even though he has it on his keychain. And his wife was there too. It was hilarious that she was like, I said, well, what do you do? Like, what's your routine like during the time that you're supposed to take it? He's like, well, I'm usually watching TV. It's evening that he's supposed to take it. I'm usually watching TV. I was like, tape it to your television or the remote control. And you can't turn on the remote without taking your medicine first.
If he has a smartphone, he should put all of his medicine appointments, times in it, because it'll buzz every time he's supposed to take it.
Yeah, that's a good method
Tell him
too.
to remember.
Yeah, absolutely.
Like, you know what I do, because I take so many pills, I have two boxes for 2 weeks, so I count them. 1, 2, 3, 4, 5, 6, 7. And I do that for each and every pill because I don't want to, and what I do is I put, let's say I have 14, so I take the first bottle and then I put it on the side. I have a big container that I have all my prescription in. And once I'm done filling out the thing, I put it there. And then because otherwise,
Double up or something.
an important one.
Yeah.
There are,
Especially when you take a lot of it.
yes, there's a statistic, and I honestly can't remember, but I know it's at least half of people do not take their medications as prescribed. So common, you know, or they don't get their medications filled because of price or side effects, or, you know, there's so many different things. But yeah, not taking them as prescribed was very common due to forgetting, due to side effects, due to so many things. But managing and finding a way to remember is huge. Go ahead, Frank.
They say take with a meal, I don't. I just take them. Is that a problem? I'm assuming if it gets my
Frank!
Why do you think I'm saying that?
I say that so you know how to set your stomach. It doesn't upset my stomach.
Well, there are some medicines and even supplements that you have to take like without food for a reason. And there's definitely some you have to take with food for a reason, like they absorb better. You need to let your doctor know or ask first.
It's not just to not have an upset stomach, it's other reasons why you want
Yeah, usually there's another reason.
This is why Frank's here too.
Yeah, I think Frank might need some extra help.
Like you mentioned before, because sometimes people can't afford medicines and
Yeah.
you don't want to take them and all of that.
Yeah.
Well, I found out this year that Humana has a payment plan.
Yeah.
So I put myself on the payment plan and I don't have any problem worrying about money.
Yeah, that was people
That's for my
that
medicines.
fell into that donut hole.
Yeah, that's what I did.
So a lot of people used to come October, they'd fall in the donut hole, and they'd go 3 months,
Yeah.
October, November, December, without taking their medication because they couldn't afford it.
Wow.
And they'd start up in January. So now, it's set up through the government, there is no more donut hole.
Right.
But the insurance companies, we have a deductible, so like tiers 3, 4, and 5. And that deductible, she's talking about, Humana lets you put on a payment plan. So certain plans have a $250 deductible for tier 3, 4, and 5. Other ones have a $350, another have a $450 for your tiers 3, 4, and 5. And that's another thing, like,
There's also
we
one
go.
medicine.
What's the donut hole?
The donut hole was when you have medications that you were paying for that the insurance no longer covered.
They have a cap.
They were high at a cap. So
Oh,
now the cap
cap.
is $2,000.
Uh-huh.
Yeah, so you were lucky, you know.
Something
I know
else,
what a cap is, yeah.
something else about paying for your medicine, since you're a Humana member, You can go on to humana.com if you haven't already, myhumana.com, and you can actually price out the medication at multiple places and see where it's cheapest.
Yeah, I've done that.
Okay, good, yeah.
And there's
I'm
another
someone
thing.
Centerville and someone CVS.
And you can work with health educators one-on-one at no cost if you are at a loss for resources like that.
Right.
They have access to the resources. They can refer you anywhere you need to go at no cost. That's a huge benefit.
I also have a colleague, Holly, that worked as a pharmaceutical rep for many years, and she's like passionate about this.
Yeah.
She can find you the manufacturer that does your medication and help you get onto, you have a high med, she'll help you find, if you're qualified, of course, that goes to the manufacturer. She'll find those manufacturers and get you set up on, I don't know. I know Ozempic, we just had a bad thing about Ozempic, but some people can't afford it. You could make up to $50,000 a year and still get on the Ozempic if it was needed. Some of those GLP-1s, some of them, like Eliquis, some of those higher meds. She's helped a lot of people. Again, she's a Humana employee, but this is also a passion of hers. She will help us figure something out for our members too. And that's not even Humana related, that's just her.
And then the Medicare Extra Help Program.
Yeah, LIS.
And the State Pharmaceutical Assistance Program. And then the Pharmaceutical Assistance Program.
Don't worry.
I don't think these are in the, I don't think these are in the book. Okay, write these down. Medicare Extra Help Program.
That's it called LIS, Low Income Subsidy.
Thank you, Karen.
And you can,
LIS.
there's a number you can call for that, I can find it for you. If you meet certain guidelines, you then get your medications for like $1.65, $5. LIS, Low Income Subsidy.
And we'll get these phone numbers for you guys.
Yeah.
State Pharmaceutical Assistance Program.
I don't even know that one.
So there's one run by the state, and then there's a federal program
A
called
lot of
just,
times they are the first thing they ask you, well, do you have Medicaid also? And then you don't qualify.
Yeah.
Well, you can qualify for LIS if you're on Medicare and you don't have Medicaid. It goes by a certain income.
You said that's low income.
You do that,
Low income subsidy.
with the manufacturer,
Yeah.
wasn't over.
okay.
What was the first one?
It's worth a try, right?
The next one she said we did LIS.
The first one, Medicare Extra Help,
That's the same thing.
LIS. Yeah. What is LIS? Low
Low
income
income subsidy, but
subsidy.
it's through Medicare.
Okay. Shopping around, mail order, like Centerwell, Centerwell is owned by Humana. That they tend to have the lower rates on.
And
on
sometimes
products.
UNC and Duke, they have great charity care too. If anybody
Yes.
knows, or anybody is in need, you have to apply for it. But they allow you to have the charity care along with your Advantage plan or whatever you have. You just have to follow their income guidelines.
And you said that's what UNC would do? Oh, charity care?
Yeah.
I have charity care, do.
Yeah, seriously. Why not?
We have a lot of good resources here.
Really?
Medicare has our Part D, and you go in there and you pick your medications, and they'll tell you what companies cost. I have one that's
So you could do that, yeah, you can see what each pharmacy is. Who is your insurance through, if you don't mind me asking?
But he might have TRICARE because he's a.
Oh, yeah. Oh, we can talk later too. We don't want to interrupt Jill's last
She needs a raise.
His wife? Oh, that's funny. Page 92, just so you know, these are all the questions you can ask your health provider when you're getting prescribed a new medication. okay? So if you even want to, you can take a screenshot of this book before you go to the doctor and ask them these questions and hold them there and make them listen until you're done, till you're satisfied with your answers, right?
They'll give you 15 minutes.
Yes.
So you,
Well, I'm gonna put another plug in.
Yeah.
We're gonna put another plug in here. So we were talking about value-based care.
Yeah.
So I know we talked about Centerwell Pharmacy, there's also Centerwell Primary Care, which they have all over the state. Ours are in Raleigh, on Capitol, and the other one is at Garner Station. They are only allowed to see, I believe it's 3 patients an hour, rather than when you go to your senior. We can sit down, they can sit down with you and, have a one-on-one. Because they are paid by keeping people out of the hospital rather than putting them in. And another thing that I think is fascinating is they have in the rooms, like a TV, so you can do a Zoom call, like say your daughter or son or somebody that you care about. You want them on it. They'll put it on there and they can be in a conversation. So Centerwell is another good resource. We have Centerwell Primary Care, Centerwell Pharmacy, and Centerwell Home Care.
And
So those
physical
are-
therapy too.
Yeah, and physical therapy. So that's another resource, but I just
Yeah,
throwing that out there.
that's a good
If
one.
you have any questions,
Can I go back?
I'm here.
Can I go back to the list of services, low income and all of that you gave us?
Yes,
Is that for reduced cost medication?
yes, for assistance with paying for medication.
Okay.
and Frank, you might even want to do a manufacturer's. Let me see if I can find out about,
He said he tried that.
oh,
Told me to go to
did you do it?
manufacturer, and I did the eligibility thing, they said, you ain't eligible.
Oh,
So I suspect maybe because I'm with the VA also, so next question, I'm
That's
gonna go to the VA.
go to the VA,
I'm gonna
yeah.
ask them, will you cover this? If so, at what cost?
Yeah, that's
So
what you
sort of
need to
a
do.
guess.
Yeah. Yeah. Definitely do that. It's a
But
VA.
my wife called me shocked. Don't take the first, I tend to go in there.
Yeah, you don't take the first no and forget about it. You wanna go? Yeah.
Yeah, that's good.
You don't go to the most expensive store to buy the shoes.
That's
My
right.
wife won't let me.
It is more convenient.
It's a good thing you have that one.
Yes.
Sounds more and more like.
She was godsend.
Sounds like an executive bonus to me for her.
It's true though, I have friends that will go to like 6 different grocery stores to pick up, oh, this is cheaper, they have better this. I'm like, it's one grocery store, I don't have the time. She also doesn't work. So yeah, she has the time to just,
So I do it at a livery. So I do it, I leave home.
There you go.
yeah.
My wife found out Harris Teeter has a buy one, get 3 free shrimp.
Yeah.
Send me there.
Oh boy. I'm glad we're having this talk about medicines because this is the most dangerous thing to mess with, right? I hate to say it, but I have seen so many mistakes that are made in my career, and I cannot stress enough to make sure your questions are answered and you understand everything about the medications you're taking. Because even if your doctor is so busy and trying to rush you out of the room, you're the one that has to deal with that, and it's extremely important that everything is safe for you. Yeah, go ahead, John.
This is just my personal thing. When I'm looking for a doctor, she has to be a woman
Huh.
because they listen. A guy, and he looked at his watch, and I said, I still got 15 minutes. He was pissed off.
Really?
Wow.
Why? Because they overbooked
Yeah.
for that hour.
Yeah.
And then you sit out there until they get through,
Yeah.
and then you come in and put, on my dime.
Yeah.
And
Yeah.
So I said, no. So I get a woman, she sits and talks to me, how's your family? How you doing? First she start.
That's called a male-female relationship. That doesn't work for everybody.
It worked for me.
I was gonna say, I don't know, John. My wife don't listen.
There are many women that don't have patience with women.
Yeah.
Women doctors that don't have patience.
That's
with
true
women.
too. I think the biggest thing, like we talked about, is, you know, that remembering that conventional medicine, even though there are some amazing doctors out there that will take the time, basically conventional medicine, 1 doctor to 3,000 patients. Whereas value-based care like Centerwell, like Karen was talking about, 1 doctor to 300 patients, that's their cap. That's why they can spend that individual attention with you, and they keep spots open for sick care, and they'll spend the time because they don't want you in the hospital because they get paid more when you're not sick. So that's the difference. Remember the term value-based care, because as a 65 and up year old, they're the ones that are going to invest the time in you above the conventional medicine. But again, I'll say conventional medicine doctors, like she has some amazing ones at Duke. There are some excellent ones out there that don't care about the pressure they're under. They will take the time with their patients. They will research nutrition. They will research the supplements you want to take. They do exist. But most of the time, the value-based ones are the ones that can take the most amount of
I
time.
had a Vietnamese doctor, I'm not kidding, I could talk with him for an hour, and he would listen.
Yeah.
Well, a lot of times you do have doctors that come from either third world or less privileged countries. They have a heart for what they're trying to do because they realize where they come from, and they don't have the types of services and healthcare where they come from.
That's true.
So I do the same thing. I look for foreign doctors too. Yeah, and I pick
Yeah, now that you say that, the ones that I work with that are, they're certified in lifestyle medicine, one's from Ethiopia and the other one's from India. Now that I think about it. Yeah.
Doctors from India.
Do you know what what Medicaid, I mean, what insurance does Centerwell accept?
Oh, great.
Not funny. No, your reaction was funny, but that's not funny. Well, we could always talk to Karen. Switch.
She's not 65 yet.
Oh, yeah, that's right. You're too young.
You're not 65 and on Medicare. Or on Medicare.
Almost.
Oh, wow.
If you press fast forward, we'll get you there.
Yeah, they have Centerville Senior Care.
Yeah.
They have what?
Senior Care.
They have seniors.
Seniors. Just specifically.
So I have to end in 6 minutes. I just want to make sure, I'm not going to spend a lot of time on physical activity, but I at least want to go through it. I know I've drilled this into your head already, so there's no reason to spend a ton of time, plus they're taking care of it here for you. But I just want to go over the numbers that are a reflection of positive overall health outcomes are that 150 minutes per week. Moderate intensities. Anyone remember how to describe moderate intensity activity?
You can speak but cannot sing.
That's right. He remembered. You can have a conversation, but you would not be able to sing. That's where your heart rate needs to be. That's about how out of breath you want to be for 150 minutes per week. You can break it up however you want to. Just don't do it all at once. And then the strength training, you want to hit all your major muscle groups at least 2 days per week on non-consecutive days. That will help your diabetes because the muscles require the glucose to function and they store glucose for energy. So they're going to take all the glucose from your bloodstream and feed the muscle with it. So that's why strength training is even more important if you have diabetes. Of course, there's other benefits like hormones will be handled better. reduced risk of osteoporosis, I mean, you name it, not to mention independence as we get older, right? Less risk of falling, better balance, better strength. But of course, if you have a chronic condition or you take medicine, you've got to talk to your doctor about what type of physical activity is good for you, because you want to make sure you're safe and you want to make sure you're doing it properly, right? Lucky for you guys, you have a class here with somebody who's certified in diabetes to teach exercise. Really doesn't get much better than that. So take advantage of the resources you have here. No secret that if you are going to go for a walk at home, you want to make sure you have your glucose tabs with you just in case. You might want to check your blood sugar before you exercise and after to see how it's affected. Wear a medical alert just in case something happens, and keep your cell phone in your pocket. Sometimes these smart watches are great because they have that crash detection, so if you were to fall, it will call 911 and your emergency contact. Just think about all the safety precautions when you are going to be alone. Have a buddy with you if possible, that makes it even better.
And even going to check your mail. I knew a lady, just going to the mailbox, she collapsed. She was there all night before somebody found her.
That's
If
terrible.
she had a cell phone or something, she could.
Yeah.
Did you say non-consecutive days for what year?
For the strength training.
Alternating days.
Exactly. Because you need a day for your body to recover so your muscles build back up.